If you've ever been looking for behavioral health supports in the state of Alabama and felt like you couldn't find what you were looking for, or Google wasn't being helpful, or you just didn't know where to start, we're doing a series of videos on an app that may be helpful to you. It's called Connect Alabama. And we're here talking with Officer Alan Hendrickson from the Dothan Police. And he's kind of telling us about this app and what he's seen it do for people, what it's done for him, and how you can get it if you do have a need. So in this video specifically, we're talking to people who might use this app to help someone else. So we're thinking along the lines of medical professionals, but we also wanted to make the point that it doesn't have to be a professional. So therapists, counselors, doctors, psychiatrists, for sure. Also, support groups, people who are in ministry who have an opportunity to help someone, or a neighbor, a friend, anyone who has the chance to offer help to someone who's in crisis, whether that be alcoholism, domestic violence, or anything else along those lines. There are ways to use this app as a tool to help people find the help that they need. So that's the topic for this video. And let's kind of start with, in case this is the only video people are watching out of the series, can you give us a quick overview of what the app is and how to use it before we start?
Yes, you just go on the web, Google, and you'll find the app, and then or your app store. Some phones make you go to app store.
Yeah.
Right? So then you download the app. The app is free, and then when you download the app, it will have Connect Alabama at the top. It'll have 988, which is a crisis line for help. It will then have different tabs that you go through: substance abuse, mental abuse, different things to that nature. At the bottom of the app, you have screen locator, which is where you enter your zip code and you can find a treatment facility near you. Okay. There's actually self-screening tool at the bottom of the app where you can go on there and choose what's going on, and you can do self-screening on the app. The beauty of the app, when you're doing, say, alcohol, and if you're being honest, you're not having a problem, instead of having to answer a bunch of questions before you get results, it will cut you off. Get a few questions in and save you some time and say, we don't think you need help.
Okay.
Again, the app has not replaced your licensed therapist. We do need those, but there's so many times that we rely peer-to-peer. So you may go on the app and choose one of the things and go to that topic and then realize, hey, I want to talk to someone. And you may go talk to a peer or a therapist, whichever one you decide.
So the app is a really good starting point, right? Because if you're not even sure, like you're thinking this might be a problem, but I don't really know. And maybe you're not ready to talk to anyone yet, or you would struggle to be honest with a friend or honest even with a therapist. This is a good place to start and be brutally honest about what's going on, and for that app to tell you kind of a yes or no, this is probably a problem, right?
Yes. So, everyone needs to go speak to someone regularly. Now, whether that's a therapist or a peer support, this app can give you that great starting point. Okay, well, if you're honest with the app, there's sections in there that would say you may need to seek further treatment.
Yeah.
The other may tell you you're okay, but you might not need a therapist right now. It does not show that you have signs. Again, this is not, a catch-all app. Don't rely just on the app, but it is a good starting point so that you can check on yourself regularly. Self-check-in. You can't fill someone else's cup if your cup is empty.
That's very true.
If you keep your cup full, it's going to overflow. So by checking on yourself regularly, self-check-ins, self-monitoring, things like that. So you can use it for that.
Yeah, that's great. It's a great idea. So tell me about, let's say there is a therapist who has a patient that they feel needs some outside resources beyond what they can provide in their office. Is there any sort of dilemma there? If they've got this patient, but they're thinking, okay, I think they need to be referred somewhere. What does that situation look like?
So that would be on the licensed therapist side. They would be the ones to decide where they refer them to. Could they say, hey, maybe start using this app in between your visits with me? It's another great resource. That is a decision that they would make on the referral, where it goes.
Okay. Have you seen a lot of people do that?
I have not spoken to any, therapist directly to ask them, are you referring the app?
Yeah.
Are you referring to, because then you get into HIPAA, right?
Sure.
So I haven't spoken to them directly, but is it a tool that they could use? Yes.
Yeah.
They could do that as a referral if they choose to.
Yeah. Okay. What would you say if someone asked you, well, how can I know how can I trust what's in this app? What gives it credibility?
So the app itself has a lot of research and data put into it. There was a lot of effort done into it by Vital and other organizations to make sure the information that it is doing is correct, and then it's researched and updated. So it's just your general use of research to make sure the app stays good. It's just like anything else. We can tell you it's a good app, but you have to just get on there and learn that it is, right?
Yeah.
Many people try to tell you things are great, but you don't know how to support it. You just know what they tell you.
Yeah, exactly.
So we would just say, hey, get on there, use it, and see for yourself,
and
become a believer in it.
Yeah. As far as people who live in more rural areas, is this a particular help to them just based on their geography?
Yeah, I think that if you look at the app and you're looking at a rural area, if you look back in, many years ago when people didn't come to the city much, right? And they come to the city and they sit down and they talk to their peers and they got help. That was the time they got help, or a doctor did a visit. So when you get in the rural settings, you may not have as many doctors in that rural county.
Right.
Or an hospital in that county.
Right.
So this could be a tool that can be used in your rural settings strongly. When you look at churches or you look at your support group, if you got an Alcohol Anonymous group that's meeting, it's a tool that they could push out to their people in their community. So community events, they could push it out as another resource because you may not have a medical facility in your county.
Right.
Not just city, but county.
Wow. Yeah. So this could be really helpful for people like that.
Yes.
What kind of professional trainings and development does Vital offer for people who might be in a situation to refer this app to someone?
So Vital offers different trainings. You can go on there and do a training request, and they do mental health trainings for law enforcement professionals, and they speak at different events about breaking the stigma against suicide or breaking the stigma of getting help. So there's different areas. I would say the main focus is the trainings are all about helping people and each other in different areas.
Yeah. Okay. So if someone is thinking about, maybe they're wondering if they have a problem somewhere in their life, but they're not sure. What would you tell them is the first step they need to take? Because sometimes that's the hardest step. What would you say they need to do?
First, you got to admit that you have a problem and become vulnerable to get help. And then you can get on the app and start screening whatever area that is. But the first major step is saying, I've got a problem, right? Yeah. So after that, that breaks the barrier of looking for help, and you can begin to help yourself.
Right. What if someone is struggling with admitting that they have a problem? Do you have any advice for them?
I would always tell people just to self-check, right? If you think that people start telling you, hey, you've been isolated lately, or not coming around as much, or you're changing, or you're not eating, there's a change in your normal self, whatever area that is.
Yeah.
That is when you might want to look to see what's causing that.
Okay.
If we are to go about our day and we do everything like we usually do, but now we're going along and we're not drinking as much water, we're not eating as much, something is going on with us as a person, which is normal to have a problem. We are human. And then you start looking for help in that area. So when you see a change within yourself, or someone tells you you're being short with us now, things like that, when other people notice that change, there's something going on. You may just need to vent, may just be under stress.
Yeah, but something is happening.
That's correct.
Yeah. We've been talking with Officer Alan Hendrickson today from Dothan Police, just about the Connect Alabama app and what it's done for him and what it can do for other people. So if you're in a position, whether you're a therapist or just a friend of someone who needs some help, this is a great thing that you can recommend to people and show them how to use it. It's free. It covers all 67 counties in Alabama, and it can get a lot of really great free tools into the hands of people who really need them. So thank you very much for being here with us. Really appreciate it.
Thank you.